VYEPTI is a prescription medicine used for the preventive treatment of migraine in adults. Do not receive VYEPTI if you are allergic to eptinezumab-jjmr or any of the ingredients in VYEPTI. Please see the important safety information throughout and at the end of this video.
Hello, welcome to the PowerShift video series, where we're going to have authentic conversations about issues impacting people living with migraine. We hope these discussions will inspire you to reclaim your power from migraine. I'm Lindsay Arnold, a Lundbeck employee. I also live with migraine. I had my first migraine attack when I was 6 years old. As an adult, I've been prescribed VYEPTI, which is a prescription medicine for the preventive treatment of migraine in adults. I'm joined by special guests today to discuss the VYEPTI infusion experience. We have Lou and Chancey here with us today, both people living with migraine who've been prescribed VYEPTI, and Anna Djurdjevic, a family nurse practitioner who administers VYEPTI. So I would love to hear more about each of you. Chancey, why don't you start us off?
Hey, yeah, my name is Chancey. I am from Southeast Mississippi. I was diagnosed with migraine about 10 years ago. I am a mom to two. I am a wife. I'm an artist, and I'm in grad school. And I was started on VYEPTI about 2 years ago.
You are a busy lady. A lot going on. Very accomplished. Lou, how about you?
Well, I don't know if I can compete. I have one kid. He is 15. I am originally from Charlotte, North Carolina. I live in Ocala, Florida. I have a husband. I work full-time in neurology. I have started on VYEPTI about 2 years ago as well.
Great. Thank you for joining us today. And Anna, how about you?
So my name is Anna Djurdjevic, and I'm a nurse practitioner at a university-based hospital in Southern California. I work in the neurology division, and I specialize in headache and facial pain, and I work alongside neurologists that are board certified in headache medicine, and together we treat patients with migraines, and some of those are on VYEPTI.
Thank you, Anna, and thanks for taking care of patients like us. So,
Absolutely.
Chancey, when you first learned about VYEPTI, where were you in your migraine journey? What was your life like, and what did you think when you first heard about an infusion treatment for migraine?
Sure. I was experiencing more and more migraine attacks. I think I was up to, over half of the month I was experiencing migraine attacks. I was having to take more and more acute migraine relief medications. When my neurologist told me about VYEPTI and it being an infusion once every 3 months, I was excited. I was like, sign me up. I need this. You know, that's where that hope, you have that hope and you're just like, yes, this is going to be it. I was so excited.
Absolutely.
And for me, it didn't take me very long to get my infusion set up.
That's great to hear. And it sounds like you were incredibly persistent to continue, seeking a treatment that works for you, even when you were kind of going through this cycle of trying new things and still, having migraine attacks really frequently, it sounds like. So
Oh yeah.
Good on you for continuing to move forward.
Absolutely. Always have to continue to move forward.
Lou, where were you when you heard about VYEPTI, and how did you feel about the infusion experience?
Well, I found out when I moved to Florida. I was constantly just more or less, not necessarily misdiagnosed, but just thrown that I had headaches, and it's something I have to live with being a woman, and this is part of growing up, and I wasn't satisfied with it. So when I moved to Florida, I saw a neurologist, I saw a specialist, and finally he introduced me about 2 years ago to VYEPTI. And like I said, I couldn't say yes to him quicker than I did my husband when we got married. So, it was something I was super excited about trying.
That's great to hear that you were, willing to give it a shot. And really, I've heard from both of you that you were really persistent in your journey
Definitely.
to finding something that worked for you.
Definitely.
So, as Anna, as a nurse practitioner who administers VYEPTI to your patients, can you tell us a little bit more about VYEPTI and the infusion process?
Yes, when I first bring up VYEPTI as a preventive treatment for migraine for my patients, I usually get that look of, oh wow, there's an IV form of medication for to treat migraines. And so I always explain to patients that VYEPTI is the first and only FDA approved IV treatment for migraine prevention in adults. I explain the process that the medication is delivered in about 30 minutes. It's given by a healthcare professional. We also always discuss risks and benefits with the medication. And it's also important to let them know that the medication is in the bloodstream at 100% once the treatment is complete.
What are some side effects that people should be looking out for after their infusion? Anna, I know everybody tolerates the medication a little bit differently.
Yes, of course. Some of the most common side effects include stuffy nose, a scratchy throat, and allergic reactions. So it's really important to talk to a provider about any questions you have about potential side effects and to report any adverse events.
And what next steps should somebody be taking after that first infusion, since it's every 3 months?
So during the infusion, I like to check in on the patients to see if they have any questions, but the patients should always make their next appointment for 3 months. And usually after the infusion, you're free to go about your day as normal. You can go back to work or just relax.
So, Chancey, could you tell me a little bit about what your infusion experiences have been like? You've had a few VYEPTI treatments now, so you're kind of a pro at this point.
So at my infusion center, I get a recliner, I get a warm blanket. I feel very well taken care of. My infusion nurses are always right there. They're looking in on me, asking me if I need anything. It's a very nice experience. I feel safe. I feel secure, and yeah.
It's great to hear that you've had a good experience. I'm kind of jealous of the warm blanket. That sounds really nice. Lou, what have your first few infusions been like? And do you have any tips for anybody going in for their first time?
It's 30 minutes. Put my earpods in, watch a movie, call it a day, and breathe a little bit and know that it's going to be better at the end of it. And there's nothing really to say that's overwhelming about it. It's great.
That's great to hear, Lou. It does sound like you're getting, great care, and it's nice that you're able to carve out that time for you. But Anna, I've heard there are more options to getting VYEPTI than just going to an infusion center. Could you tell me a little bit more about where people can get VYEPTI?
Yeah, there's multiple options. It's determined by the provider or the insurance, and also location. So in my practice, we have an infusion center, and some of our patients would prefer to come to the infusion center because they're comfortable with the staff. If they live far, we have patients that come like 3 hours away or even more. We would find a facility near their home and then set them up for an infusion there. We just find out if they administer VYEPTI there, send the prescription over, and they infuse or the order. And then if they want to do it in their own home, we set up home health for them if the insurance allows it. And so there's a lot of options.
Your voice is so nice. That makes me want to come to California and you infuse me. It's so welcoming. You just have this calm. That's awesome. I'm glad people are going to get to see you. It makes
we have the recliners. We have the recliners. We have the warm blankets.
I gotta catch Florida.
We have the warm blankets.
See?
Yes, and snacks.
So, Anna, as someone who administers VYEPTI and is seeing people come back every 3 months, how does it feel for you to see and hear about people who are embracing their life a little bit more and experiencing fewer migraine days?
Well, it's always so rewarding to to be able to help this patient population, and being able to see them during their infusion, and then it allows me to observe their progress over time. And it makes me it's really happy to see positive outcomes. It's a really positive experience.
That is great to hear. It has to be very rewarding. I know I'm lucky to get to see the same infusion nurse every time I go in for my appointments. So that's been nice to have that continuity. And she always makes sure to ask, how I've been doing. So it's nice to get that relationship too. So Chancey, can you tell me a little bit more about what you've been doing with fewer migraine attacks in your life?
With more migraine-free days, I feel more free. I can do things that I haven't been able to do in a very long time. For example, I had red wine for the first time in over 10 years, and I didn't get a migraine attack, which was unbelievable. I'm not constantly worried that I'm going to have a migraine attack. Like, I don't feel that looming presence that might, oh, well, today or tomorrow might be the day that you get one. You make sure you don't eat this, and you make sure you don't drink that. So I'm not as worried about, triggers. I'm not as worried as I was. And I feel more free as a result.
And Lou, what have you been doing with more migraine-free days? How has this impacted your life?
With more migraine-free days, I feel like I have a life again. I'm able to do things that I wasn't able to do before. Go to soccer games, go outside, be in the sunlight, not have to wear sunglasses all of the time. I go on dates with my husband, things I haven't been able to do in years. And it's given me this opportunity, like, just to breathe, to live. And I can't be more thankful for that.
That's great to hear that you both are, really getting to live and experience your lives more and, feel better on a more regular basis. Chancey, could you give me one power tip that you have for someone who might be going in for their first infusion with VYEPTI?
I would definitely recommend dressing comfortably and wearing layers.
Yes, I think that's a really important one. You never know what the temperature is going to be, and the nurse also has to have access to your arm, of course. So it's good to make sure that you wear something a little bit flexible. Lou, what's a power tip that you've discovered through your infusions?
Bring a book, bring a tablet, live your life as if you would every day. Don't stop because you're in an infusion center. So if you use a tablet every day, or you're on your phone, or you do whatever, do that.
Chancey, if you had to describe your mindset shift, how your life has changed in one word, now that you've started your infusions with VYEPTI, how would you describe that journey, or describe how you're feeling now?
In one word, I'm thankful.
Amen.
That's a very good one.
That's perfect.
And Lou, what's your one word to describe how you're feeling now?
So my one word would be hopeful. Hopeful has a lot of power in it. And to me, that's what it's about.
Wow, so inspiring. Thank you, Lou and Chancey, for spending some time with me and telling me a bit more about your experience. And Anna, thank you so much for lending us your expertise for the evening and sharing your point of view.
Please stay tuned to listen to important safety information for VYEPTI, and visit VYEPTI.com to learn more about IV infusion for the preventive treatment of migraine.
Please listen as we share important safety information about VYEPTI. Approved use. VYEPTI is a prescription medicine used for the preventive treatment of migraine in adults. Important safety information. Do not receive VYEPTI if you have a known allergy to eptinezumab-jjmr or its ingredients. VYEPTI may cause serious side effects such as allergic reactions. Call your healthcare provider or get emergency medical help right away if you have any symptoms of an allergic reaction. Rash, swelling of your face, lips, tongue, or throat. If you have trouble breathing, hives, or redness in your face. High blood pressure. High blood pressure or worsening of high blood pressure can happen after receiving VYEPTI. Contact your healthcare provider if you have an increase in blood pressure. Raynaud's phenomenon. A type of circulation problem. Raynaud's phenomenon can worsen or happen after receiving VYEPTI. Contact your healthcare provider if you have symptoms such as your fingers or toes feeling numb, cool, or painful, or changing color from pale to blue to red. Before starting VYEPTI, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, circulation problems in your fingers and toes, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including any prescription and over-the-counter medicines, vitamins, or herbal supplements. The most common side effects of VYEPTI include stuffy nose and scratchy throat, and allergic reactions. These are not all the possible side effects of VYEPTI. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, please see the prescribing information and patient information on VYEPTI.com.